Pathology paper 1, 3 markers. We are on the fourth question. He says tuberculoid leprosy. Okay. So what is leprosy? Actually, before all this, just look at these pictures. See this Ajji. See these fingers. And this is how the leprosy looks. Okay. See how dangerous it is. Just look at the pictures for now. See here. This is called as Leonil faces. See here, nasal bridge has gone. White patches, hypopigmented patches. So guys, bacteria are no joke. Okay, we have leprosy. Leprosy is also called as Hansen's disease because Hansen was the person who might have discovered this. It is a slowly progressive infection caused by Mycobacterium leprae. In tuberculosis, we had Mycobacterium tuberculosis. This is Mycobacterium leprae. Both are acid-fast bacilli that mainly affects the skin and the peripheral nerves. Okay. Then we have, despite its low communicability, leprosy remains endemic among the people in several low income tropical nations. Okay. So we'll come to this at the end. That is just like a summary that you can write. I just want to explain you guys this thing. And this is the classification, this is the theory. You guys just pause and read for once, and I'll just explain this. So we have what? We have T cells, naive T cells, okay, new T cells. Now this actually in the leprosy, in order to win against the leprosy, in order to win the battle against the leprosy, we need this immunity. Cell mediated immunity. We do not need much of the humoral immunity. In cell mediated immunity, what will happen is the macrophages, they will come into action and they will engulf, phagocytose the bacteria, and that's how the leprosy will be controlled in the body. And if the leprosy is controlled in the body, that thing is called as tuberculoid leprosy. Tuberculoid leprosy. Tuberculoid leprosy means this is the less severe form of the leprosy. Only if your immunity is strong enough. And which kind of immunity? That is cell mediated immunity, not the humoral immunity. If your cell mediated immunity is good, the macrophages will come and eat all this cigar shaped bacilli. Okay, you can see this clump here, that is called as globi. Okay, so we have the naive T cell, a newly formed T cell, CD4 positive. If you give interleukin 12, it turns into TH1, which is T helper 1 cell. Then if there is interferon gamma, interleukin 2 or interferon beta, all these things, if it is present, then it will convert into this thing CD8 T cell. Okay, that is cell mediated immunity will be triggered. So your macrophages will come into action. But if this part of your immune system is weak, okay, then say body somehow has to battle with this bacteria. So if this is not there, then this pathway will have its action. So interleukin 4 will convert this into T helper 2 cells. From there are many interleukins which can activate the humoral immunity. Okay, then eosinophil and everything, B cells. So we do not need much of this immunity here, because we need bacteria to be killed, or the number of bacteria should be less. So we need the macrophages in order to engulf all these bacteria. But in case of humoral immunity, what happens is they release antibodies, and these antibodies will form complexes with the antigens of the bacteria, and by forming complexes they will deposit multiple places in the body, in the nerves, in the kidney, in the blood vessels, okay, in the tissues, and they will cause inflammation. Okay, so in this case the bacteria number will not decrease. Okay, the bacteria number will be increased only, and that thing is called as multibacillary. There is something called as paucibacillary, and then there is something called as multibacillary. Paucibacillary is when the bacterial load is less in the body. And how did it become less? Because of the strong cell mediated immunity. And for that cell mediated immunity, we need T helper 1 cell. But If this thing is weak, then we will have humoral immunity which will have complexes, and there will not be any death of the bacteria, rather the bacterial population will increase, and that will lead to huge amount of damage in the body. Okay, as you have seen here, see, look at the surgery, look at these fingers and everything, how deformed it is. Look at the face, and you can see here, see this face, all this thing. So we have lepromatous leprosy, tuberculoid leprosy. This is the most this is the least dangerous, this is the most dangerous. Okay, so yeah, and this is the classification of the leprosy from the microbiological aspect. So we have Ridley-Joplin classification, Madrid classification, and Indian classification. So from the lepromatous leprosy till tuberculoid leprosy here. So from the most dangerous to the least dangerous. And actually what happens here is, see, this bacteria, they love cold places. Okay, if they invade the human body, they will love to go to the extremities or the skin, because there the temperature is much cooler than the core temperature. So they reside in the cool tissue around 32 to 34. Then, as he is telling us, cell mediated immunity is manifested by delayed type of hypersensitivity reaction to dermal injection of a bacterial called as leproman test. So this is a lab diagnostic test, something called as leproman test, where you check the cell mediated immunity. If the cell mediated immunity is good, that means you are at least on the safer side, you are at least on the tuberculoid leprosy, where there can be loss of sensation, okay, at the places, something called as dry, scaly, patchy lesions, hypopigmented lesions, okay, where there is no sensation. So essentially these bacteria, they love to go to neurons. Okay, inside the neurons there are the cells called as Schwann cells, and in the Schwann cells they enter, these bacteria, they enter the peripheral nerve ka Schwann cells, and after they enter this, our immunity anyways, it will be activated. So macrophages will be activated. These macrophages will go behind this bacteria, and as these bacteria, they entered into the Schwann cells of the nerves, of the peripheral nerves, these bacteria will try to kill these bacteria, and in order to kill them, they will also damage the Schwann cells and the adjacent part of the neurons or the nerve, right? And because of that reason, there will be hypopigmented lesions, then there will be loss of sensations. Okay, so the loss of sensations or the symptoms are due to the action of the immune cells. Okay, but if it is not controlled, if the macrophages and the cell mediated immunity is not there, or it is less, then the humoral immunity will be more, the bacterial growth will be more. So bacteria will, if not the immune, the bacteria will damage the neurons, okay, in huge amount. So let's see, mycobacteria into the Schwann cells and into endoneural and perineural macrophages damages the peripheral nerve system. See, in order to kill those bacteria which are already present in the Schwann cells, the mycobacteria will have to damage the nervous system. Okay, and that's how there will be loss of sensation and other things. As mentioned earlier, tuberculoid and lepromatous leprosy are associated with different T cell responses. So that depends on the interleukin 2 or interferon gamma and everything. So if you have interleukin 2, interferon gamma, the T helper 1 cell will get activated into cell mediated immunity. If you don't have this, then this will automatically get activated. Then lepromatous leprosy is associated with a weak Th1 response, and in some cases a relatively increase in the Th2 response. So in lepromatous leprosy, which is the dangerous form, I have already told you T helper 1 cell will be less, the cell mediated immunity will be less, and Th2 response will be more. Okay, so occasionally, most often in lepromatous leprosy, antibodies are produced against M. leprae antigens. Paradoxically, these antibodies are usually not protective, but they may form immune complexes with free antigens that can lead to erythema nodosum, vasculitis, glomerulonephritis. Okay, so yeah, as I told, we do not need much of humoral immunity because that is of not much of use. They form complexes and they deposit here and there, and then they cause inflammation everywhere in the body. Morphology, tuberculoid leprosy, neuronal involvement dominant tuberculoid leprosy. Nerve becomes enclosed with granulomatous inflammatory reaction, and if small, are destroyed. So again, they are also forming granuloma. What is granuloma? We discussed in the earlier video. Inside, so granuloma is nothing but it is like a cage, okay, cage for the bacteria or the foreign pathogen. If the body is not able to kill the bacteria, it tries to contain it by making a jail, okay, jail of cells, so that the bacteria do not escape that jail. So we have modified macrophages, epithelioid cells, we have surrounding that we have the lymphocytes, okay, and this bacteria will be at the center. Then we have all this nerve degeneration, skin anesthesia, skin and muscle atrophy, contracture paralysis and auto amputation of the fingers. Okay, then because of the strong host defense, bacilli are almost never found and is called as paucibacillary leprosy. So tuberculoid leprosy is the safest compared to lepromatous. Why? Because it is paucibacillary. What is paucibacillary? Less number of bacilli. How? Because of the strong Th1 response. How? Because of the interleukin 2 and interferon gamma, and there is strong cell mediated immunity. Macrophages will come and engulf the bacteria, so bacteria number will go down. But anyways, it will also lead to damage of the Schwann cells and the neurons. Hence, there will be all these symptoms, hypopigmented, okay, loss of sensation and all. So what is the difference? Mota difference is tuberculoid leprosy, lepromatous leprosy, well demarcated dry patch, disfigurement is here. So this is the severe form. Okay, in this there is huge number of bacteria and there is no one to tackle those bacteria. So they are like independent, they can do whatever they want in the body. So they disfigure the face, something called as leonine face. That means the face looks like something like lion. Claw-shaped hands, pedunculous earlobes, saddle nose, see? So suppressed low resistance. Then we have well demarcated dry patches, minimal disfigurement, all these things are not there. Good immune response or high resistance. So our body has high resistance against this, and this has low resistance. So that was about the leprosy, mainly tuberculoid leprosy, but we have also seen about something about lepromatous. So for the 3 marker, you can write tuberculoid leprosy, immune response, strong cell mediated immunity. Why? Because this is tuberculoid. So paucibacillary. So we have strong cell mediated immunity. Few bacilli in the lesions. Clinical features: skin lesions, well defined hypostatic patches, nerve involvement, peripheral nerve damage due to granulomatous inflammation. So skin lesions here well defined, and hypostatic means loss of sensation here, okay. And nerve involvement, peripheral nerve damage due to granulomatous inflammation. Histopathology: presence of granulomas with few acid fast bacilli. Okay, so these are all acid fast bacilli. Done.